This presentation talks about waste disposal methods in pharmaceutical facilities. It is prepared by myself and my colleague Muhammad Ayman and submitted to Dr. Shireen Hamdi. This is an outline for the presentation. We will talk about the definition of pharmaceutical wastes and their classification, steps before disposal followed by the disposal procedure, methods of disposal, and finally, recording and reporting. Definition. According to Section 47.5 of Waste Prevention and Management Regulation 2012, pharmaceutical wastes include medicines or biological products as blood, serum, vaccines that are expired, damaged, incompletely used, spilled, rejected medicinal products, and recalled medicinal products. General requirements. Disposal is necessary for a wide range of chemicals which possess an inherent health risk and environmental hazards. However, the quantity or the method of treatment might be. People handling hazardous wastes from segregation to disposal should be supplied with the suitable protective gear, including face masks, boots, and hand gloves. Classification of pharmaceutical wastes. Pharmaceutical wastes are classified into three categories. Hazardous wastes. According to the federal EPA regulations, hazardous drugs are divided into P-listed items that are considered acutely toxic as nicotine, epinephrine, and nitroglycerin. These drugs, along with their containers, are considered hazardous. U-listed items that are considered toxic as phenyl, chloral hydrate, and selected antineoplastics. The D-list contains items that produce wastes with any of the following characteristics: ignitability, corrosivity, reactivity, or toxicity. The second category of pharmaceutical wastes includes non-hazardous wastes. They include materials that pose no health threats. These materials may contain hazardous components, however they do not exceed the threshold for causing harm. Non-hazardous wastes also include inert substances that have no pharmaceutical properties but are used medically, such as sodium chloride and dextrose solutions. The third category is chemotherapy wastes. They are further classified into trace and bulk chemotherapy wastes. There is no specific distinction between the two. However, if there is a potential for chemotherapy contamination, items that should be managed as trace chemotherapy wastes include empty ampoules, IV bags and syringes, gowns and wipes, materials used for cleaning and decontamination, safety cabinets, and glove boxes. Steps to be taken. 1. Decision. It is initiated by the regional or district pharmacist, the hospital, or by organizations with pharmaceutical programs. 2. Approval. Approval for disposal is sought from the appropriate authority. This authority may be the Department of Pharmaceutical Management within the Ministry of Health, and in some countries the Ministry of Environment is involved. 3. Planning. It involves the funding, human resources, the necessary expertise, time, space, equipment, as well as materials. 4. Forming work teams. The teams formed should consist of pharmacists, supervisors, and general medical workers. Health and safety. Workers should be equipped with protective overalls and boots at all times, as well as masks, caps, and gloves when necessary. 6. Sorting. The main objective of sorting is to separate pharmaceuticals into categories where different disposal methods will be applied. 7. Disposal. Disposal options vary considerably, and the ideal solution may not be feasible. Therefore, the aim of guidelines is to provide the safest, simplest, and most practical alternatives. 8. Security. Security measures are necessary to prevent diversion or pilfering of drugs. An example of these would be immobilization, which is the best method for preventing pilfering from a store or a landfill. This is an outline for the steps involved in the process of disposal. First is the segregation at the source into packaging materials, hazardous and non-hazardous wastes. Second is the transportation to the collection store, followed by the transportation to the site of disposal. And the final step is when disposal is carried out. Segregation at the source. Packaging materials. Secondary packaging material is removed and disposed of as dry waste, while contaminated packaging materials along with the medicinal products are treated as pharmaceutical wastes. Hazardous wastes. Pharmaceutical wastes that are deemed hazardous are discarded in proof purple plastic bags or containers that are labeled hazardous pharmaceutical waste. Non-hazardous waste. They are discarded in green plastic bags or containers and labeled non-hazardous pharmaceutical wastes, then solid waste or liquid waste. Transportation to the collection store. This step involves storage before disposal. Pharmaceutical wastes in health facilities or hospital wards are returned to the pharmacy store. This is accompanied by filling a waste generation report. Transportation to a disposal site. This is the final step prior to disposal. In this step, sealed waste bags should be intact and in place at the end of transportation.
Now I'm going to talk about disposal methods. Disposal of hazard wastes. The first method is encapsulation and landfill. Hazard wastes should be disposed by two methods, which is encapsulation and landfill. Wastes should be immobilized or encapsulated prior to disposal into landfill. Steps of encapsulation include removal of waste material from their secondary packaging but not from a primary one, filling on steel or plastic drum up to 75% with the waste. The remaining space is filled by cement, lime, or water. Drums are closed with lids and placed at the base of landfill before finally covering with soil. The second method is incineration. Specifications of incinerators should include rotary kiln type incinerator with two chambers with minimum temperature 1100 degrees and capacity range depend on generated wastes. Incineration of pressure to containers should be avoided to prevent explosions that could damage the equipment. Disposal of non-hazard wastes. There are two types of non-hazard wastes. Non-hazard solid wastes, and we can use landfill disposal method, and I talked about it before. And the second type is non-hazard liquid wastes, and we can use sewer method. Sewer is a fast-flowing water sources could be used to flush the diluted wastes. Other disposal methods, such as chemical decomposition. Chemical decomposition used as alternative to incineration if the appropriate incinerator is not available. It's done according to manufacturer's recommendations and followed by landfill. A disadvantage of chemical decomposition is a process being tedious, it's time consuming, chemical used in a treatment must be available at all times, not suitable for large quantities. Return to manufacturer is also another disposal method. Returning unusable drug to manufacturer for safe disposal is also an option, especially drugs that present disposal problems such as anti-neoplastics. Return to manufacturer is also another disposal method. Returning unusable drug to manufacturer for safe disposal is also an option, especially drugs that present disposal problems such as anti-neoplastics. The last thing I'm going to talk about is recording and reporting medical wastes. This step is important for future planning. It also helps on monitoring the compliance to waste management guidelines. Any wastes taken to storage facility should be individually weighed and reported. We're finished our presentation. Thank you for listening.